I think this is a fascinating question. And I hope we have enough time to even discuss it. Many community practice physicians are still not familiar with the less common oncogenes in lung cancer. What remote consult options are available now that telemedicine visits are becoming less common as pandemic waivers on interstate licensure are going away? So before, I'm going to push this and let my co-panelists answer, but before, I just want to make sure we frame this for our audience. During the pandemic, well, we're still in a pandemic, but when it was at its peak, states waived licensure requirements. So it used to be that if I wanted to practice in South Carolina physically, I needed a South Carolina license, right? Even though the requirements are pretty much the same, my North Carolina license didn't allow me to practice in South Carolina. Once virtual medicine became a thing, in pretty much all states, it's where the patient is physically located that defines where the visit is happening. So if I wanted to see a patient virtually in South Carolina, I would need a South Carolina license to do it. Even though I'm in North Carolina, my license doesn't do it. During the pandemic, a lot of states made waivers to make virtual care easier. And virtual care has now become more familiar to patients and doctors alike. And as there's a perception, at least, that the pandemic is going away, those waivers have largely been eliminated. And so the question is about what options are left. And I'll invite my co-panelists to comment in any way you want on this, because I think it's an extremely important question, if not just to targeted therapy, but to the whole purpose of GRACE as a whole, democratizing information and getting it to our patients.
Yeah, I'll say, this is a great question and a really, tremendous, challenge, because it was nice to be able to do these, remote visits for, patients in different states. I will say, one thing that the pandemic did was really expedite utilization of telemedicine and teleconferencing. And I think as we sit on, this teleconference now, I think we've all gotten so used to doing these teleconferences where we initially weren't used to doing this. And I think one major advantage, that our institution and numbers have performed during this time was really opening up our tumor board discussions to a variety of community practices, really, throughout the state and nearby areas. And so I think that has really been instrumental in educating a lot of the surrounding community practices about, appropriate biomarker testing, how you go about testing, when to use, various, sequencing methodologies, whether it be liquid or tissue, and how we conceptually think about, our patients with lung cancer. And I think independent of the, pandemic, I think that we're, going to continue to offer that. And I think it's really been, instrumental in bringing, a variety of practices and in a variety of different practice settings, to have the opportunity to both present patients, like at our tumor board at an academic center, and then to observe, our own way that we discuss our patients and management strategies.